Welcome back to this Week in Review edition of Bayou Time. This week, doctors and medical personnel from around the country flocked to the 17th annual New Cardiovascular Horizons conference held at the Roosevelt Hotel in downtown New Orleans. The conference features the latest developments and procedures in treating cardiovascular disease, including live demonstrations of surgeries in progress from across the globe. HOMA's own Dr. Craig Walker founded the event 17 years ago and has watched it grow into the mega conference it is today. HTV's own Katie Dayrosh caught up with Dr. Walker at the conference to discuss the highlights of this year's event.
New Cardiovascular Horizons is a conference that we started 17 years ago. It started off as a fairly small conference. Now it's one of the biggest peripheral vascular conferences in the world. And what we're trying to do is educate people about arterial and venous problems outside of the heart. So the heart is certainly a lot of attention paid to it throughout conferences around the world. But venous and arterial disease involving the legs or involving the arms or in the circulation to the brain really gets much less attention, yet it's equally deadly. It's a very common, in fact, both arterial and venous problems of the leg are more common, just of the legs, than heart problems. And they're associated with equally high mortality and morbidity. So we think it deserves a lot of attention. And I think you see the attendance here attests to the fact that many others agree with that.
The way we make wires flexible is we taper them. As we grind these down, it makes the wire more flexible. So as you might imagine, as you get towards grind 2, this wire is going to be much more flexible than it is back before taper 1. It's more rigid at that point.
New Cardiovascular Horizons keeps growing, and in large measure it's because it's really an innovative meeting. This year we have many firsts that are firsts in the world. We have the first ever in the world session on the similarities of the treatment of blockages below one's knee and of the heart when the vessels are totally blocked, and how to use tools that we use in each to treat the other. It's a very important subject. Dr. Sehedri Raju is going to be giving the first ever talk that he's done here at our meeting on venous reconstruction. He is the world's authority on rebuilding veins that are blocked in the abdomen or treating ovarian veins that are leaky that cause women tremendous pain in the abdomen. We have Dr. Ghassan Kassab, a world-class inventor who's made many devices that have changed people's lives. He's going to be giving one of the seminal lectures. He's going to be speaking on the importance of new technology and interfacing with the clinician. Dr. Lombardi is who's going to head the coronary CTO session. He is inarguably the world's authority on treating coronary CTOs. I'm just very excited about the faculty that we have doing this, and we have the first ever session at any major meeting for interventional nephrologists, a whole new discipline. So we have, of course, cases coming in from around the world. We really have the world's authorities across the field, the inventors who've brought us most of the new technology we have. They're all here. It's really an exciting event, and certainly we're excited about being the hosts of this event.
And can you explain a little in detail about some of the cases being presented?
Sure, let's start with the cases done already this morning. One case came from Germany. It was a patient who had a severe blockage of the abdominal aorta right below the kidney arteries and the left iliac artery, which runs from about our navel to the hip bone, was totally blocked on the patient's left side. And this was treated with minimally invasive technique. Now, why is this so important? This used to require major surgery, very big risk of death, fairly significant morbidity where the patient would be in the hospital for many days. This patient is done and will go home today in a few hours with really almost no pain. Very important. The other case was a patient with ulcers on their foot, and that patient had totally blocked arteries from the hip to the knee on the left side. And this was crossed in an unusual manner that many can use. And the way that this was crossed is less expensive than to use re-entry tools and probably more effective. And then it was treated with a brand new kind of stent, Supera. I was very involved in the development of that stent in the past. The stent's more flexible, has greater radial force, and I helped to make the delivery system for that in the past. But they were able to show a perfect example of utilizing this in this kind of case. Now we have all sorts of cases that we'll be working on people who have big ulcers on their toes or who have gangrenous toes to avoid major amputation. We'll show carotid stent cases. We'll show opening up blocked kidney arteries, gut vessels, treating aneurysms, treating carotid arteries. All of these are going to be shown during this course. We have 32 live cases from the world's leading centers, all being shown on a big screen.
And can you explain some of the highlights from the event, the conference?
Sure, some of the highlights I've already mentioned, some of these meetings that we have, and of course the live cases are highlights. These are the world's masters showing their showing how they do cases. I would say that's really important. And the other thing is the Horizons Group. The Horizons Group is a group that we have founded, and it goes around the world teaching people. You see this event here, but in addition to this major event, we have 17 regional meetings around the United States. These are meant to educate doctors and communities about better treating peripheral arterial and venous disease. In addition to that, we have 4 meetings in China, and we have 1 meeting in Latin America. And so we're sort of busy bees, the Horizons Group are, and it takes a lot of effort from a lot of guys to be able to go around and really spread the word about the fact that there's better treatment for these disorders. It's the only way we'll get the message out and improve care around the world. We're excited about doing that. So that's, I'd say, the real take-home message.
Can you explain how NCVH is very beneficial to the community and just to the world and cardiovascular health care in general?
Sure, it's that way in so many ways. To start with, if we just take HOMA and say, what does it mean economically for HOMA? This whole event is based from HOMA, and so we have many people required to help stage this event to begin with. Secondly, we have doctors that come to HOMA and they visit HOMA routinely. Every week we have people from around the world. We have had many, many doctors from China come through. These people go out to eat. They stay in local hotels. Some of them buy cars when they're there. So it certainly affects the economy in that sense, but much more importantly, it means better health care for our community. It keeps us on top of everything that is new in the world, and if we can improve the health of our community, which we've done, if you look at the change in death rates in the regions in which CIS exists, we have lowered mortality. We have done a great job with that as a group, and we want to do yet a better job with that. But we've made a big impact, and if we have a healthy community, that helps a lot.
And can you explain a little more about the industry support and the devices being presented as well?
Sure. For industry can come in, and of course they can only support devices that are FDA approved. But industry really wants to make sure people are educated on this. There are some parts of industry that even support this meeting in things that may indeed hurt some of the devices that they have, but they're developing new things. They understand that the progression of medicine is inexorable. This is not going to change, not for anyone. We're not going to just hold still. If we don't change and evolve, we will fall behind. We won't keep up, because to keep up requires staying ahead. We have to keep changing constantly.
And lastly, what's your favorite part about the event?
Oh, I have a lot of favorite parts. Probably the closing event, because I'm awful tired by the time that comes around. This is a lot of effort, and you might imagine not a lot of sleep in between, but so many parts. Opening up this morning, I had thrills just thinking about how many people are here watching, learning, about how many lives may be affected around the world. Each day as we do these, I can reflect back on where we were, where we are, what we're seeing happen. I get letters the whole year after this about how it changed practices, how it saved limbs, how it saved lives. And so it is not just a single event, it's all of those things put together. It's really a phenomenal feeling, and it's something that we're incredibly proud of.
Coming up next, Hillary Domingue has all your local sports. Stay tuned.